All right. Thank you all. Keep those locations coming. We're going to get things started because we have a lot to discuss and a great presentation. So welcome back to those who are with us again, and welcome to those joining us for the first time to our this webinar series. Today's webinar is our last and will be on mosquito and rodent control preparedness. My name is Chris Walker, Senior Program Analyst here at the National Environmental Health Association, and I will be your host today. To begin today's webinar, I will highlight a partnership between two organizations and provide a brief overview of each and what they do. Then I will introduce our speaker, in which she has an amazing presentation planned for you today. We will have a Q&A session following the presentation. And as we come to an end, we will provide a few final announcements and some upcoming opportunities. With that, allow me to cover a few housekeeping items before we get started. Please note that this webinar is being recorded. The recording will be uploaded onto the NEHA Vectors and Pest Webinars webpage. You can also find recordings to past webinars from this series, as well as past webinars that we've conducted. And the web address is www.neha.org/vector-webinars. If you have any questions for our speaker during the presentation, please use the Q&A option to submit your questions, and we will attend to them during the time. You can find the button to the Q&A at the bottom of your screen. And for those using this webinar for continuing education, we will provide a link that shows how you may submit continuing education through our NEHA page. And at the conclusion of the webinar, you will receive a link to take part in the evaluation survey to provide feedback and comments on today's webinar. This webinar is brought to you in part through a collaboration between Gulf South Vector and NEHA through grant funding from the Centers of Disease Control and Prevention. Allow me to share some information about both organizations. The mission at the Gulf South Vector, and that's Vector Educational Center for Training, Outreach, and Resources, is to forge a robust, innovative, multidisciplinary, and cooperative regional network. They aim to provide innovative training and resources to professionals and pre-service students, creating a unified workforce that enhances regional capacity to monitor and respond to vector-borne disease threats. If you want to know more about this organization, you can scan the QR code on the screen, or you can visit the webpage at vectoroutreach.org. Now, those of you who may not be familiar with our organization, allow me to provide a brief overview of who we are. We support the environmental public health workforce. As an association, everything we do is to build, sustain, and empower environmental public health professionals so that they are equipped and prepared to protect the health and communities across the country. We support environmental public health and continuously provide the most up-to-date training, tools, and resources to the workforce who specialize in so many different fields of environmental health. NEHA is focused on increasing knowledge and skills across our fields to build upon workforce capacity and effectiveness. We also offer credentials to certify the expertise of our workforce. No matter where you are in your educational journey or professional career, NEHA has something for you. Please, if you want to know more about the organization, there's the QR code, or you can go to our website to learn more at www.neha.org/membership. Now, allow me to introduce today's speaker, Claudia Riegel. Claudia earned her degrees from Purdue University, University of Georgia, and obtained a PhD from the University of Florida. Directly out of school, she worked in private industry as a field scientist in the urban pest management field, Responsibilities included providing technical support, collaborate with the government, organizations, universities, and customers. In 2004, Claudia became the principal research entomologist for the City of New Orleans Mosquito and Termite Control Board. In 2006, she became assistant director, and in 2010, she was promoted to the director of that same department. At the city, she provides technical support for the City of New Orleans, and the pest control industry conducts independent research, collaborates with the industry for enhancements of existing products and testing of new products, and collaborates with government organizations and universities on a variety of research projects involving rodents, mosquitoes, termites, and a variety of other urban pests. She participates in several professional societies at the national and local level. She has authored articles and training modules, and Claudia speaks at pest control and public health meetings around the country and internationally. Claudia, the floor is all yours.
Thank you so much. Thank you, Chris, for the invitation. Thank you, everybody. There's quite a few people online from all over the world. So I've been watching people pop into the meeting. So I appreciate it. I'm going to go ahead and share my screen so we can go ahead and get started. And here we go. All right. Well, thank you again, everybody. Thank you, Chris. Thank you to Neha for this collaboration. I think this is just really a great topic to talk about. So actually, one of my favorite topics is about preparedness. I've been at the city for a long time, 20 years. And so really about a year and 8 months after I started, Hurricane Katrina came in. And it was really, devastating for the city of New Orleans and the region as well. But we learned so many things from that storm, and we've been incorporating things into our program over the many years because, of course, New Orleans in the region is very susceptible to other storms. So I'm going to talk a little bit about vector-borne diseases and really focusing on mosquitoes and rodents for this one, and to really talk about the big picture and some of the components that I think would be good to have so that you are prepared for any kind of event. And so a lot of times we are talking about hurricanes, right? But it can actually be a lot of things. And so that's why we really use the terminology all hazards. And there is a need there for vector and urban pest control. There's lots of issues there, of course, and it could be for transmissions of disease, right, to humans and to animals. I think, West Nile virus or Zika virus, in the past, those are great examples. They're often with these big catastrophic storms, there will be populations of people as well as animals that are displaced and more vulnerable to these insects and rodents. It definitely can interfere with response. If you look at state of Florida, for example, when these hurricanes come in, huge number of floodwater mosquitoes are a big issue after these storms. And then, of course, potential economic impact, tourism, travel. I actually happen to be in Miami Beach right this moment, right? And this is one of those situations in 2016 where those big blocks, were put on these areas from CDC for pregnant women not to travel. So that can definitely impact the tourism. So passive concern after, let's say, a hurricane situation, typically flies and mosquitoes are the first ones. Flies usually are the first things you're going to see, especially if there's an issue with trash pickup. Mosquitoes, wildlife is another one that may have been displaced, stray animals as well. Rodents come later in the sort of succession of issues, but it's definitely a concern that people need to be aware of. So this is an example from 2021 in New Orleans post Hurricane Ida. And so these are floodwater mosquitoes. Over 11,000 were caught in the trap over, 24 hours. So these are huge numbers. These are strong flyers. They are active really around that right at dark. So they really are mostly a nuisance mosquito, but can be really interfering with operations. The other thing I wanted to mention from a disease standpoint, this is a paper that was published several years ago, but it did show that in New Orleans and Mississippi, that there was a two-fold increase in West Nile cases in the region, and so in Louisiana and Mississippi. And so again, people are in recovery trailers. They're more exposed outside because they're cleaning out their houses. They may be gutting it or working on their homes. So they may be more exposed to these mosquitoes and potentially West Nile virus infections. And I want you to think about, right, you can get on an airplane and you can be somewhere across the world in just a few hours, and just the traffic, right? This is just the flights from air traffic throughout the world, but there's also cruises and ships that are moving around. So people are moving around from country to country and place to place, and it's really easy to get there. Especially with worldwide travel, you could be going to a place, maybe to Brazil or to some other country in Asia. You're having a great time. You get bit by a particular mosquito that might be infected with some sort of pathogen. You come home, you start to feel not so great, and you happen to have those mosquitoes that are competent vectors for whatever arbovirus, for example, or even malaria that you have brought back. And next thing you know, the area has local transmission, right? So this is what we are thinking about from a preparedness standpoint, and those types of things we want to avoid. And I think a great example of that really was Zika virus back in 2016. And so introduced by a viremic traveler. And, there are surveillance programs in these mosquito control areas, and really trying to do what needs to be done around travel cases and control and education, right? So all those things were done, saving lives and, in the end, preventing, really snuffing out that local transmission. And one of the things with the Zika virus, actually, that was very important is really interagency cooperation. So we saw that across the states, specifically for Louisiana, a lot of different agencies that weren't talking so much started to work together, and fortunately, that has remained. The next disease that everybody should be looking at right now, especially if you have Aedes aegypti in your area. So I saw some folks throughout the country that I know you've got Aedes aegypti there, Aedes albopictus as well, but Aedes aegypti are your primary vector for dengue. The Caribbean, South America, there's a raging epidemic going on right now. So your programs really should be doing some public outreach for your residents, communicating that you really need to take precaution when you go. And so wear your repellent, your lightweight long sleeves, just be aware, right? So what we want to avoid is a viremic person coming back and infecting your local mosquitoes. Unfortunately, it's already happened in, Florida. And so we want to prevent this in other Aedes endemic areas. This is a map from CDC. And these is the approximate distribution. They've learned a lot after Zika virus because there's been a lot of surveys to document where Aedes aegypti and Aedes albopictus are located. And so again, look to your local surveillance programs for your mosquito control programs, good communication. If you're out there and you're working and you find an Aedes aegypti and you typically don't have them in your area, you definitely need to collect a specimen and get it to your local experts, your universities, your mosquito control districts, so that it can be documented. So very important to do that. We talk about emergencies all the time. So I'm going to be going back from mosquito and rodent. And again, I want you all to think about it from an all hazards. And it's hard to believe, right, that it's been 4 years already since the start of the COVID-19 pandemic. But in this particular case, this was down in New Orleans and everything got shut down, and rodents came looking for food. And this was during the pandemic. So our folks continued to work. We didn't have any, we were considered already essential workers here in Louisiana for pest control and vector control. So we didn't have a lapse in work, and we were able to really utilize that time that people weren't on the street, people were renovating their properties to work hard on reducing the population of rodents in particular areas. So there's lots of vectors out there when we think about it, from mosquitoes and flies and ticks, kissing bugs, mites, fleas. Those are all great examples. But don't forget that rats and raccoons, bats and others also can transmit different or pathogens, infectious pathogens between humans and these animals. So there's the WHO definition up in the corner. Many of these are going to be blood-sucking insects, right? Of course, ticks and fleas and all that business. So mosquitoes, those are typically going to have a blood meal that's involved. From mosquito control, there's lots of different diseases depending on where you live. Okay, so it's important to be tied into what is endemic in your particular area and what you should be looking out for. So a lot of your state health departments are going to have this information. Your local mosquito control programs will also be doing surveillance potentially. So it's important to know. But malaria and chikungunya, Zika, you can see the list. I want you not to forget about dog heartworm. It's a huge issue from a veterinary standpoint. Louisiana has incredibly high prevalence of dog heartworm. So people here must do prophylactically treat their dogs. Otherwise, it's likely that they will become infected. So from rodents, there's lots of diseases worldwide, and this came from the CDC, but it's important to know what's out there. Hantavirus, of course. Here in New Orleans, we are not going to it would be incredibly rare to see something like that, or even plague. That is not something we're going to normally see here in Louisiana, but in other parts of the country and world, that is something that you can see. The big one, obviously, that we're concerned about, there are several, but leptospirosis is a big one. And so if you have a rat infestation and there's water around, just things of, letting your field inspectors or yourselves, you should always wear closed-toed shoes, exposed wounds. There's big flooding right now, or there was a big flood in the southern part of Brazil. And actually people are dying of leptospirosis. And so a big number of people, unfortunately. So, and that's transmitted in the rat urine, a bacterial disease transmitted in the rat urine. And then of course, somebody walks through water and there's some sort of opening and they get infected. So rodents can transmit directly, or they can spread disease by their ectoparasites. And again, there's a big list there. And we're really worried about murine typhus. There's others as well, but think about the unhoused community. That's a big issue. And so the flea there is involved with that cycle. So important to know. Rocky Mountain spotted fever, again, another one that's important worldwide. But it's important to understand what might be in the area that you live in. So anything that we do, right, we need to think about, especially from a preparedness level, you have to have certain things in place. And sometimes it's a lot, right? You may not be able to do everything at one time. But the way we've done it here is that you have a plan and then you work towards it so that you keep making progress each year. And really the first step is to have a response plan. There are SOPs out there. You don't have to reinvent the wheel. There are plans out there. And actually, Chris talked about the Gulf South Vector Program. We're actually in the process of gathering SOPs that are out there for mosquito control. We are updating the mosquito response plan so that these things can be available on the website so that people can use it, download it, and modify it as you need it. But there are plans out there. You just need to do a little bit of homework. You need to have a robust surveillance system. So that's mosquito collections and virus testing. Know the resistance situation, how you manage your data, right? So if your data is a mess, it's going to be really hard to look at that over the course of time. Infrastructure is a big thing. You need equipment, supplies, trained personnel, contingency contracts, very important to have in place. Interagency cooperation, breaking down those silos. And we have to do education, not only of the public, but of the professionals as well, from government officials and medical professionals, so that they don't miss those infections, those symptoms, right? And ask, did you just travel? Did you go to the Caribbean? Or where did you come from? The Amazon jungle, or wherever it is that you potentially could be bringing back one of those pathogens. So very important in the diagnosis. So we like to use the term, integrated pest management. I think everyone knows what that means. And it's going to have a little bit of a different definition depending on, what pest or, vector you're working with. And so with mosquitoes, surveillance and source reduction, the use of pesticides, very important. Resistance testing, that is one of those pillars. Biological control agents, so mosquito fish, would be a great example. And then, of course, public education. So we're going to go through this and explain some of the examples. And again, we talked a little bit about definitions and how it can change based on your pest or vector. And so for rodents, we really focus on that education. You really need to touch everyone here, your business community, the public, everybody involved, because you may have to look at code and to follow and make sure that the trash is in good condition, because sanitation is absolutely critical for rodent control. Doing inspections and surveillance. Sometimes the only thing you can do really is to close a building through exclusion. And of course, we're going to talk a little bit about population reduction through the use of trapping and rodenticides where needed. Now, I'm sure a lot of folks, and look, I've been there right with you. I don't have enough money to do it. How do we do it, right? And so again, you have to scale up and you learn at each step. And so sometimes you have to do a survey instead of year-round surveillance, right? So what's a survey? One-time gathering of information to assess the situation. But what you want to do is move towards surveillance, which is that continual process of monitoring the changes, especially in a mosquito population. And so very, very important. It's going to tell us when you need to implement control measures, but you also want to measure with the surveillance if your treatments have been effective. And it might be treatment, or it might even be, for example, source reduction in a particular area. So very important to get going. These happen to be the locations, it's a little map of New Orleans, and the little red dots are where we have our static trap site locations. And so we have a bunch throughout the city. We actually add and remove when needed, but these stay static always. And so in the case of adding and removing would be, we're looking for a potential issue with dengue, right? So we may have to supplement traps around the ports and other areas where there may be some tourists. So that's what I mean by adding and removing or modifying. There's lots of types of traps out there. You know, I know programs use a variety of different traps, from BG Sentinels to Gravis. It's just CDC light traps. Really just depends on what your target mosquito is. I wish there was a trap that was absolutely fabulous for everything, but that's not the case. And, you know, identify your mosquitoes to species so that you know what is actually in your traps. The bottom left, there's an ovicup there. You can see there's a paddle inside, and those little black flecks are eggs of Aedes albopictus and Aedes aegypti. It is super critical that agencies work together, especially in the arboviral surveillance program. So the state of Louisiana actually does a fantastic job of communication, and there's a lot of cooperation on this. So actually the state legislature gives money to LSU for arboviral testing. So it's the foundation for it. Programs supplement it. So our samples cost about $325 a mosquito pool for it to be tested for a variety of arboviruses. And so there's great participation in the state through programs. And so we collect the mosquitoes, traps go out Monday, they pick up Tuesday. By Wednesday at noon, the mosquito samples, we keep it on the cold chain, is at LSU for testing, Louisiana State University. By Friday morning, we know what is going on with our mosquito pools. And then Friday afternoon, a whole network within the state receives information about what is happening in the entire state. So there's a lot of communication, and you can keep the pulse, right, of what's going on for arbovirus situation in our state. All right, source reduction, right? So I look at these photos and waste tires. We have lots of problems with waste tires. It's gotten better recently, but it's still a lot of dumping of tires. And so again, it's moving and communicating with other agencies for enforcement, or with you know, our sanitation department that deals with bulky waste. And so there's lots of communication that goes on, because it's impossible for us to go and remove all of these tires, right? It has to be a teamwork situation. And so I'm just giving you this example to think about. I'm really challenging all of you. How do you communicate and leverage other resources that are out there? so that we can, attain the same goal. Same thing with the building up on top. That's a lot of stuff, right? Saucers and containers that might be holding water. So of course we try first, always working with residents before any enforcement is done, but because we ultimately want to educate folks on what to do. But those are a great concern, especially, with some of the mosquito diseases on the horizon. These are a little bit older, but you can see the huge numbers of tires. And the big issue was like, what are in those tires? Is Aedes aegypti going to be a big issue? For us, actually, it wasn't. It was Aedes albopictus, but Culex quincunfasciatus, the southern house mosquito, they love tires. And so our southern house mosquito often acts just like a container breeder. So it's very important with that. And of course, West Nile virus is our biggest issue here in New Orleans. So we have to educate our customers, which is our residents, but also our partners at the city on why it's so important to remove these tires. So when it comes to control measures, the use of pesticides are just part of a mosquito control program. So of course, make sure all of our folks are licensed here. So we actually work it into our job description so that when we hire somebody, we have a 1-year probation period, and it is mandated to get a Louisiana Department of Ag and Forestry license. And I really recommend that everyone look at their job descriptions and work that in, right? I just met with Miami-Dade County. They have the exact same thing, which is so great to see. So their folks must be licensed. They have a 1-year probation period. You got to go get it. There's a whole great variety of reasons to do it, professionalism, all kinds of stuff. And I think EPA on the horizon is going to make some changes. We don't really know what that is yet, but it's always great to stay on top. All right, so there's different types of treatments that you would do. Not everyone's going to have an aircraft, all right? Not everyone's going to have all these tools, but you got to start somewhere. If you have the need and have the funds for an aerial contract contingency, that might be something that you need to have in place. So you may never use it. Hopefully you never will. But during emergencies is not the time that you want to be creating SOPs and writing bid specifications, because it's a lot of stress. So have it done before. I know we're all busy, but I'm telling you, if something were to happen, you're ready to go. There are also residual treatments. Not too many mosquito control districts do residual treatments, those yard style treatments that are residuals. You will see yard treatments, but mostly the ULV kind, no residuals. But our pest control community uses a lot of residual treatments. So make sure you're looking at drift. Make sure you're looking at rotating products. Larvicide, when you can, back off on those applications, get away from the schedule. So all those things are going to be very important for resistance. Larviciding, use it, and use it, right? To do area-wide larviciding, very expensive. But to do smaller scale, it's really the labor, everything else, because a little bit goes a long way. So those are the kinds of things that you could probably start thinking about is, all right, well, how do I get there, right? One step at a time. When targeting mosquitoes with ULV, you have to make sure that you are targeting those mosquitoes at peak activity time. We definitely want to increase the chances, right, of those droplets impinging on those mosquitoes. You may actually have to do multiple applications for disease intervention to actually impact that population. And we learned in South Florida that alternating ULV and area-wide larviciding is the way to go to stop transmission. So I put those papers there. You can take a picture of the screen and go read it for yourself. But that is something in 2016, we did not in New Orleans have that capacity. It's now 2024. We can do it right on the ground, and we're about to be able to do it by air. But it's taken us a long time to get here. But we're pretty excited to actually be able to do it now. And so look at those meteorological considerations, look at the weather, the application, the droplet size, all that stuff needs to be really done correctly. We do not spray adulticides during the day at all because of our non-targets. We want to avoid any of that. So again, I had mentioned that at the time, we really didn't have that capacity. But what we ended up doing is piece by piece, testing out different pieces of equipment to try to optimize. And once we did, That's how we moved forward. So again, 2016, I think this project was done with the helicopter in 2018. Finally, we were able to upgrade our aircraft, and we just, ordered the tank for larviciding. So sometimes you have to find the money and get your allies, right, in order to bring that funding in that you need to do the work. For resistance testing, it must be done, right? We want to make sure that pesticides are not misused, overused, and honestly, there aren't a lot of options in mosquito control to rotate. But you have to really pay attention. We want to make sure that you're catching resistance prior to having resistance. What you don't want to do is all these applications with the product and the mosquitoes are resistant. It's not going to work. You're wasting time providing false sort of comfort level for residents, and then you're wasting a lot of money. So if you don't have the ability to do resistance testing, the Centers for Disease Control and Prevention have kits that they will send out to help you do that. Of course, you may need to do some rearing, but there are universities and other agencies that would very much, be happy to participate. You just need to find those folks through the network, but there's lots of folks that can do it. Here's just some examples of bottle bioassays, right? So pretty straightforward for the most part, and at least getting some idea of what is going on with your target mosquitoes will be very, very important. There are also other tools that you can use to look at, in this particular case, is KDR knockdown genes. So we're looking for pyrethroid resistance. And this one, in particular case was with our Aedes aegypti mosquitoes, right? So we wanted to make sure that everything was okay. And so again, I mean, this is 2018 or so. We tested every single, the A1 and A3, A4, you can see the spray zones. We were looking for, what was actually going on. And for the most part, our Aedes aegypti at the time were very susceptible. Just last year, though, we said, you know what, we need to do a quick check, and things completely flip-flopped. And so this year, we're spending a lot of time looking to see what may have happened in just a short period of time, which is about 5 years. So important to stay on top of it and continue to check. Public education is incredibly important. You can pick your messages, right? For us, keep it simple, reduce those conducive conditions, eliminate the water holding containers. You really need to train a lot of people. So it's from your employees, but look at all the different people. Everyone here needs to know about vector control in general, and make sure that that message is consistent and often aligned with your other agencies that are there. And so, which really leads into breaking down silos. And it is incredibly important, okay? It encourages collaboration, supports better decision-making process. It boosts productivity and fosters innovation. There's a lot of reasons why you should talk to the other agencies and other folks in your region or across, right? The country or wherever you may be, to see what people bring to the table. Attend meetings. You guys are attending this meeting, which is super great. And so you're getting my perspective, right, on this whole story. And so hopefully there's future collaboration there with others. And so that is a very important thing. When you're doing education, you may do it in-house. You may work for an agency, for example, that is all centrally located on education through one component of it. So at the city of New Orleans, we have a communications department, but we have our own social media feed at NOLA Mosquito, so you guys can go check it out. But we make all of our social media content, webinar flyers, we make all of that. Press releases we write, but it goes through our communications department for review before it goes out to a whole lot of people. So you're gonna have to really figure out what works for your region. You can see they're talking to kids. That's always super fun. Working with professionals in the field. There's some folks that are not going to have telephones. I know it's hard to believe, but it might be a flip phone still. There are other people that's all the way they get the news. And then there's going to be groups of people, no matter what you do, they're absolutely, no matter what the situation is, they're not going to want you to do any kind of treatment as far as pesticide treatment. So you really do need to think about how to effectively talk to a wide variety of audiences. This happens to be something that's been very popular with us. It's a little bookmark. We have a variety of bookmarks. We leave them at the library and hand them out. It's something a little bit thicker, something that somebody may keep. But we also use these little squares on cardstock that we make for our social media account. And so a variety of topics, very simplistic message. But again, you need to target your audience and see what you want to say. And so these are examples. We just use an online platform. It's very inexpensive. It's less than less than $120 a year to use that online platform. And trust me, I'm telling you, anybody can be an artist on that, because they have lots of different templates that you can use. And then you start to like think about and create a whole series of just different documents that you can use online and also in person. Lots of training here, right? That's very important. So that's, again, breaking down those silos. That is training the community so that you're participating, but maybe your organization already also does some training on site. It is incredibly important to really work with your administrators and educate folks on why your field is so important. We actually fall under our mosquito control in New Orleans. So it's City of New Orleans Mosquito Termite Rodent Control Board. We fall under we're an independent board, well, really a department of the city, but we fall under the umbrella of Homeland Security. And we've been there since 2008. So we work a lot with other agencies through coordination of events that may happen if it was West Nile virus or Zika virus and, whatever it may be. But work with your state health officers, your EPIs of your department. Make sure everything is aligned in the messaging, because if it's not, it really creates mistrust. And the whole point here is just to educate folks on what is going on. I would absolutely prepare some press releases in advance. I'm going to go back to what I said before. When you are in the moment, there's 50,000 things going on at one time. So it's really important to have at least a baseline that you can work from, and it will make your life a lot easier. Sometimes we have to educate physicians and veterinarians and pest control and other folks, right? So there may be a little bit of a twist on some of the documents that you are creating to really target that audience. And so again, it's relatively simple information, but presented in a little bit different way for your target audience. So there's lots of examples of that. And we actually hope with the Gulf South Vector, we're actually creating this content now that it will be available for a lot of folks. So let's just twist a little bit here and talk about rodents, okay? And I think it really means to be prepared for a rodent control issue. And so some of the basic information and infrastructure that are needed, you really do need to know species that are in your service area. Not a lot of places have done these surveys of what species are in my area. So it's very important for you to do that, including the ectoparasites, because a great example here is that in New Orleans, we've got Oriental rat flea in parts of the city, but in a big other chunks of the city, they're nowhere to be found. And so it's very important to know that, and you're going to understand the different kinds of disease cycles and pathogens that are there. And so that'll make a difference in if something does show up. You need to have well-informed and funded municipal or state rodent programs. There aren't that many nationwide, all right? We're actually doing a survey state by state looking for these programs. And so if you happen to be one of those, reach out to Mr. Walker, all right? We want to know, or put it in the chat so that we can reach out to you. Very, very important. You need to have some way that the public is going to report sightings, right? They're really, for a rodent, routine surveillance or periodic surveys is usually what people do, oftentimes working in collaboration with universities. Interagency cooperation, information sharing, very important. You must understand the infrastructure of your city. We are in an old city here in New Orleans, and so sewers and all of that, there may be breaks, and that's all very important. Understand your industry, private industry capacity, what that's out there. I hope you're communicating with your pest management professionals, very important. What tools do you have available, right? So second generation anticoagulants are no longer available in California. And right now, EPA is reviewing it. So we'll see what their decisions are in the future, but that is likely going to change the way we do business. And public awareness, of course, and we need the public, right, to participate. I already mentioned this already, but programs are all over the place as far as capacity. A lot of places don't have a program at all. And so very important for us to be working towards supporting rodent control programs throughout the United States. And what we find is, unfortunately, a lot of people are working in silos. And so again, we need to make sure that people are communicating and collaborating together. So the ones that we deal with, and depending on where you are, there's going to be other species that are not commensal rodents, but this is the big one here for a lot of us. It's going to be the roof rat, the Norway rat, and the house mouse. So I saw there was somebody from Wisconsin on there. You're not going to see the roof rats, I hope. But Norway rats would be something that you would see. And again, if you're along that coastal region of the United States, you're going to see that. House mouse pretty ubiquitous across the country. And, you know, with climate change, and temperatures getting warmer, it's very likely that the expansion range, the range of where you find roof rats is going to increase. These are great agents, you know, for transmitting disease. You can have very high populations and they hang around us in those sort of paradomestic, you know, environments. We would need to worry about contamination of food, destruction of property, disease transmission. There's been enough work out there done that you should assume those rodents have a pathogen. Increase in asthma cases, especially in kids, and if there's a school that's infested with mice or rodents. And of course, nobody wants to see rodents in their city. It just doesn't look very good, right? We don't want to think that that's what's there. So the thing with rodents, especially these commensal ones, boy, there's lots of different ways that you can be infected. There could be transmission of some pathogen between these animals and people. And so it can be through coming in contact with saliva, blood, urine, right? In water, for example, leptospirosis is a big issue. Indirect contact as well. You can have vector-borne with flea or tick, but typically a flea or a mite is what you're going to see with rodents. And then, of course, eating something foodborne, right, that is been contaminated, especially with feces from an infected animal. So these are all different ways that you can have transmission. After a disaster, typically a flooding disaster, that's what you see mostly in the literature, is that there's going to typically be a lull, right, where you're not going to see that activity increase right away. It's typically between 6 and 10 months after a disaster. It was spot on in New Orleans. It was around that time where we started to see activity increase and more calls come in because there was just a lot of stuff there that as people were cleaning out their homes. But you know, you need to know what species are across your area. Fortunately, we know that here in Louisiana and New Orleans, actually. And this summer, we've hired a bunch of interns to work alongside with our rodent management team. And we're going to be doing a lot of trapping and collecting samples, tissue samples from these animals in order to analyze them for pathogens, and also looking at the genetics of these animals across our area and really how it has changed. And so this data, it's all been published. Anna Peterson, Bruno Gersi, Mike Bloom, I think I'm on there as well, there's lots of different pathogens. This happens to be Bartonella. It's not going to kill anybody, but it can make somebody pretty sick and cause some issues. So you can see it's prevalent. This is what I worry more about because we have so much water, is Leptospira. And again, we need to really educate folks to make sure that not to be going through floodwaters. If you are outside and it's raining, you should be wearing closed-toed shoes. Lots of reasons here. I'm not going to go through all of it just for the sake of time, but there's lots of issues why you can have pest problems and what are those contributing factors, right? And so I know no matter where you live, some of these issues some of these items are going to be an issue. And so again, it helps you put the perspective of like, maybe I need to be focusing on some of this so that I can be more prepared if there is a disease outbreak or there is a big infestation of something. So we've talked about this already, but really from a rodent standpoint, we use a 311 system. We provided the scripts, and I just picked a random year, but we provided the scripts to our 311 saying, hey, I want you to answer these questions, or at least get the resident to answer these questions. So it's not, hey, I have a rodent problem, come over. I need to know a little bit more information, right? So that's very important. And so once you get these numbers, and we don't have a lot that comes in each year, you can start to look at where there is a higher prevalence so that you can go and do some field inspections to take a look. When you're looking at rodent-borne disease, it's, I will tell you, poorly studied, all right, across the states. There used to be a lot of money that was invested in, especially murine typhus and other things. And over the many years, it just really started to decline. And now it's typically tagged with a university. There are some districts that do it independently, which is great. But typically it's in line with a university that's doing a project. Very important. I'm just going to put this out there for all of you. Murine typhus is on the rise, and it's not only associated with rodents, but also with possums. So you need to be paying attention, particularly in your in-house communities. We need nobody to be getting sick, and you need to keep a pulse on this. You can do this work. Of course, you have to collect the rodents, and you can do the tissue samples and look at it using molecular tools, which is great. So you can put it in the freezer. You may not have the infrastructure in-house, but try to partner with somebody, again, breaking those silos, right, that they can. So very important. We need to work really closely with our state sanitarians, with your code enforcement, with your sanitation rangers. We need to say this is not okay. So, and really pest management as well. And so we need to really deal with the trash in location so that you don't have the conducive conditions that are supporting these infestations. We are actually right now, we did create Magnet, for example. That's the one the dumpster guidelines can go on for businesses. But we also did flyers on what proper dumpster management is, rodent prevention, right? We are actually re-looking at our code, our municipal code right now, to see how we can better approach some of these egregious cases. If there were to be one in our area, which unfortunately there are, how do we put teeth into these municipal codes so that we can get these things changed? Again, working in homeless encampments, you cannot turn a blind eye. You really need to deal with it. Unfortunately, it's just a lot of food. It's a lot that's available. So typically you are going to have a rodent infestation if you have an unhoused community. We happen to be using more carbon dioxide if you happen to have that in your region through right now rat ice, which is the pellets, but also there are tanks. Leaf-A-Tech is selling the tanks with CO2. You have to be a pesticide applicator for it. But boy, it's been a real game changer for us. There's no residual. You can deal with the problem right there. You, of course, and you're working in these areas, you need to really be careful wearing your PPE so that your workers are safe always. We do a lot of trapping here, a lot, okay? It's very effective. You can do it interior and exterior, but you need to know biology of that rodent and how it behaves. And so you cannot be sloppy. You really need to understand how to do it. And if you do, you can be extremely effective. And so again, there's lots of, California's got a rodent academy, Texas has one, we have one, New York City has one. So there are a lot of places. National Pest Management teaches. So there's a lot of places that you can go to really learn some of these tools. And again, this happens to be right after COVID shutdown in New Orleans. You can see this is actually on Bourbon Street, and there are no people there, which was so strange, right? But again, we took an opportunity here to really focus in and reduce numbers of rodents. Sometimes it is simply as putting concrete down and patching a hole. There are no pesticides needed here. And so don't forget about these environmental conditions and pest proofing, just simple solutions that, will be very effective. We
Claudia, just let you know you have about 5 minutes.
Sounds good. So we're going to wrap it up here for you. But the use of carbon dioxide, if you can use it, again, you need to be a pesticide applicator to do this. Do follow through. It's been a real game changer for us. And I think we've talked about that. Little things that you can do to make things easy for yourself is close your garbage cans. Select garbage cans that are actually closed. Great, the city has done this for a long time, but we need to educate our residents to keep the lid closed and actually clean them as well. So rodent control is very important, right? In working with other agencies. And just wrapping up here, I really want everybody to think about setting goals. It is overwhelming when you don't have enough money to do it. I don't have enough staff to do it. Actually, I don't have any more hours in my day, okay? But you really need to think about it and have that leadership set these milestones for each year and keep moving it forward. And really think about how you're training your employees and who you're bringing in with certain skill sets so that you can meet those goals. This is going to help you build that local capacity. Find folks that love what they do, right? Super enthusiastic about vector control, because I'm telling you that makes a difference. And so explore different options for funding. Improve your efficiency. That's an easy one, right? How can we do things in a better way? Of course, you can increase budget requests, but make a good case for it and why you need it. You can do product testing, working with different companies. You can do collaborative projects with universities, partner with them. They may have funding to get some of these answers that you need. We actually embed students that are doing master's degrees and PhDs, and they're working on very specific projects that we want answered, but don't have a lot of time. So just to wrap it up here, and Chris already talked about it, but last year, we're actually in the fourth quarter of the first year. It's the Gulf South Vector, so Vector Educational Center for Training, Outreach, and Resources. So we are one of those projects that were awarded by the Centers for Disease Control and Prevention to help strengthen training, evaluation, and partnerships in the prevention and control of vector-borne diseases. So we're pretty excited about this project. We are looking, even though it's from Texas to Florida, but honestly, there's a whole lot of people from a whole lot of states that are jumping on board, and we're really excited. So I'm going to go ahead and put this slide up here as the last slide, and you can go to the website. It's up now. It's called vectoroutreach.org. We're building that website, but at least there is a forward-facing now, so you can learn a little bit more about the project and sign up to get more information. So there's lots of opportunities for training. We want folks to conduct surveys for us and all of that. If you are in Texas to Florida somewhere and you are interested in jumping on board, there's my email there at the bottom, okay? So, or reach out to NEHA and they'll connect us up. So with that, thank you very much. I appreciate everybody's time to be on.
Perfect. Thank you so very much, Claudia. We do have a few questions, so if you have the opportunity to answer a few, and just to let everyone know that we won't be able to cover all the questions, but we will share the questions with Claudia and allow her to provide some responses, and we'll share those with all of the attendees.
Definitely.
So first question, with the high concern and imminent threat of dengue near your southern borders, where are things at?
Yeah,
and any key updates, insights, late breakers that you may have.
Absolutely, right? So look, we've been thinking about this for a little while, right? So in New Orleans, we started early in the year with communications internally. Let's revamp our Zika plan that we had out there, which then we converted into Mosquito plan. And so right now we're getting that updated. We hope to have that very soon, and we're going to be making that available. It definitely will be on the vectoroutreach.org website, so that anybody can look at it. So I think that's important. We are actually creating materials right now for educating the public. I'm actually here in Miami-Dade County as well. I'm here for a meeting, and also to do some work with the Gulf South Vector and their folks. And so I know just from communications today, it's totally on their mind. They're working through as well. So it's really important to start prepping those things now. We're still kind of in the beginning of the season, even in New Orleans. There's a bit of what happens with Aedes aegypti. So we have Aedes aegypti. So you need to even know if you've got that particular mosquito. Aedes albopictus is also a vector, but they also feed on other animals quite a bit. So we really do think that Aedes aegypti are going to be your big target. The other thing is there's been communication already with our state epidemiologists so that we can all get on board. So right now is your time, right? If you are in one of those South Florida, South Texas, in those Gulf states where you do have Aedes aegypti, you need to really start thinking about, am I trapping? Am I communicating with your state EPIs in your other districts? But right now, everybody should be doing communication to your constituents about traveling abroad and the precautions to take.
Perfect. Thank you for that. I think we have time for one final question. Suggestions on how to advocate for zoonotic programs at public health agencies that are no longer funded, meaning the
Yeah.
work is not happening.
Yeah, look, I mean, this, I won't lie to you, it is a tough sell, right? But again, I want everybody to go to vector-outreach.org, and you'll see that there's a video on there that'll be me talking about this project. What we're trying to do is take a little bit of a different approach, right? And because I know you have to go to the folks that have the money. Those are typically your mayors, your governors, your finance directors. Those are the folks that you have, CAOs. You have to plead your case and say why it is important, okay? And so we're going to be creating documents that are targeting that group of people so that hopefully you'll be able to use some of those things too and say, look, you know, it's about preparedness. We do not want to be reactive. We want to be proactive. And look, surveillance is expensive and it's mostly silent in the background. And so part of it in our strategy here is, I mean, we have a tremendous amount of support here, and we've had it for many, many, many years prior to me even arriving. And so we run a very data-based program with a lot of communication internally. So people know what we do and we continue to push it forward. So I think that, you know, try to figure out who are the people who have funding and how are we going to explain to them, right? And hopefully we're going to be producing some of these tools for everybody that you can use, because the whole point here is to prevent animals, well, really people and animals, from getting sick, right? So having messaging, having documents that all of you may be able to use. So there's no good answer, okay? But we all need to be talking about it all the time and advocating not only to ourselves, but when I walk around, I love what I do. So I talk to everybody about vector control. I mean, like everybody, okay? So I think that's very important that if you're advocating for a program, you need to start doing that.
Perfect. Thank you for that, Claudia. And we are coming to the conclusion of this webinar. Would like to encourage you to complete this survey through the Gulf South Vector. This will be helpful in the development of training materials. How do you want to learn? Hands-on, podcasts, webinars, virtual. What are the barriers to learning? This will be really important. So this will be something that we'll share also to everyone with some of the questions that were remaining. We want to meet people where they are to better increase capacity for vectors. And if you missed the first two webinars of this series, I encourage you to look at the recordings, which are stored on the NEHA Vectors and Pest webinar webpage. So we also want to thank again the Gulf South Vector group for supporting 3 amazing webinars. Claudia, thank you so very much. We also want to thank Janet Hurley, as well as Alex Pavlakis. Wonderful webinars. So thank you very much. And as we conclude, we want to lastly, if you have, or if you're not currently a member of NEHA, to consider thinking about it. There's no other organization in the world doing what we're doing to support the environmental public health workforce. So together we can strengthen our voice for policy and funding. And the more aligned we are in best practices and better equipped we are to help protect the public health. Thank you all so very much for your time. Be on the lookout for emails. You'll see an evaluation as you leave this webinar, but we thank you all very much and enjoy the rest of your day.